All right, so today we've got Ian. He came in as a musician. He was having a lot of problems with his hands and wrists, lots of pain. It got to the point where it was very hard for him to play the piano. We've also been working on his respiration, his breathing. We found a lot of problems with how he was able to physically take a deep breath in, and his body and his breathing was in this fight or flight state. So he was breathing very high up in the thoracic spine when we started. So we've been working on lowering his breathing, getting his rib cage moving a lot freer, and then working on fixing his hands. So let's get him adjusted. Ian, I have you turn your head to the left, then head to the right, head straight. So I'm going through a protocol here where I'm looking for where we want to start adjusting him. And we've got some subluxation down at the sacrum and up in the cervical spine. So I'm going to determine now where I want to start. Keep breathing for me, Ian. There you go. We're going to start with his sacrum today. And your sacrum is extremely important. If this area is subluxated, that means that bone's not going to move properly. It creates tension in those muscles around the low back, the pelvic floor. But if the sacrum can't move freely, you can't efficiently pump spinal fluid back up your spinal cord. This moves to push fluid back up towards your brain. So a sacrum subluxation can really irritate a person in ways they don't realize. Okay, next we're going up to, looks like the thoracic spine. All right, we're gonna adjust T1. As always, I'm using my integrator adjusting tool. Very, very precise. As I'm adjusting him, I can feel the bones move. I can see his breathing change. I can see his spine and breathing relax instantly with the adjustments. I love using this integrator tool because of the precision. I'm not a fan of twisting and popping people's necks and spines. I just don't think it's a very precise, accurate way to adjust people. All right, just keep breathing here. And lastly, we're going to adjust the cervical spine. C5. C5 has nerves that run down into the hands as well as down to his diaphragm, the phrenic nerve in there. So it's a very important level. All right, let's see how the low back stability is looking. Lift here and down. Lift the whole leg for me. There you go. And then lift this one. That feels great through the lower back. Take a deep breath in. All right, we're going to do some more ribs right through here. Just want more mobility. These might feel a little tender. Then I'm going to work on his hands, and we'll do some cranial and TMJ adjusting. Take a deep breath in. Way better on that side. How do you feel breathing, Ian?
All right.
Feeling good? Okay, take a deep breath in. Okay, that looks great. All right, the next thing we're doing here is we're working on Ian's hands, wrists, and elbows. I could do this on almost every person I meet now because of our devices and our phone. So I'm starting up on his elbow on the radius bone. For what I find is it gets fixated in there and it can't rotate properly. But with Ian, he plays piano, so we have to keep his hands and wrists as mobile as we can, keep the muscles relaxed. What's great about hand, wrist, elbow adjustments is I can feel the results right away. The alignment improves, the muscles relax, the patients can typically notice right away an improvement. All right, that looks good.